My name is Mohammad Afiq bin Kiprawi, and I will presenting about audio enhancement to medical imaging DSP application unveiled. So, in introduction, DSP involved manipulating signal like audio, video, temperature, pressure, or the data from sensor to improve quality or extract useful information. DSP convert analog to digital signal, then process and convert them back to their original or new converted signal. DSP technique can enhance the clarity and quality of sound in audio enhancement, making medical imaging easier. Application of DSP in medical imaging technology include MRI, radiography, and ultrasound. So in this presentation, I will explain about the theoretical and the application. So for the theory, I will explain about a few things about the DSP technique that used in the medical field like noise reduction, image enhancement, and image reconstruction. While application, we explain about how the theory is being applied in real world. The application that we'll discuss in this presentation are radiography, MRI, and ultrasound. In theoretical, I will explain about 3 points, that is noise reduction, image enhancement, and image reconstruction. So for noise reduction, in medical imaging is the process of minimizing or removing unwanted disturbance or artifact from medical imaging data. For image enhancement is a technique to enhance the specific feature for the image, such as contrast of the image, brightness, and sharpness of the image to make the image more easy to human interpretation and image analyzing. Lastly, image reconstruction, that is mathematical process where the measure projection raw data and related to the image data which describe the patient object with the use of X-ray spectrum and beam geometry. So for noise reduction, they have 2 transform that use, that is Fourier transform and wavelet transform. So Fourier transform used to transform signal from the time domain to the frequency domain. Noise can be more easily identified and removed in the frequency domain. For wavelet transform, it provides a time frequency representation of that signal, useful for non-stationary signal processing. For image enhancement, they have 2 equalization that use histogram equalization and CNNS. So histogram equalization, this technique improves image contrast by spreading out the most frequency intensity values, making the details in the image more visible. For CNNS, used for tasks such as super resolution, tuning, and artifact removal, can significantly enhance image quality through the advanced deep learning algorithm. Okay. So for the last point, that is image reconstruction. They have 2 points, that is inverse problem regularization and deep learning approach. So 4.1, solving inverse problem with regularization technique like Tikhonov and total variation, OTV, to stabilize reconstruction and preserve important features. For deep learning approach, utilizing CNN and GAN for high quality image reconstruction by learning complex mapping and generating realistic image. So now we move to applications. So they have 3 applications, that is radiography, MRI, and ultrasound. So for radiography, what is radiography? It produces the use type of high energy radiation called X-ray to take pictures of area inside of the body. X-ray pass through the body onto the film or computer where the pictures are made. It usually appears in shade of black and white because different tissues amount of the X-ray beam to pass through them. Radiography mostly used to help diagnose disease and plan treatment such as cancer and broken bones. So radiography have a theory behind it. So for image point 1, image enhancement, noise reduction, DSP technique like Gaussian and median filtering reduce noise in X-ray image and improving clarity. For contrast enhancement, methods such as histogram equalization enhance contrast, making the structure more visible. Edge enhancement, the edge detection algorithm like Sobel and Kenny improve the visibility of boundary in the image. Point 2, image reconstruction. Compute tomography or CT algorithm like filter back projection FBB and interactive reconstruction create a detailed 3D image from 2D X-ray. Projection allow for better visualization of internal structure. Chemosynthesis used for multiple 2D image taken at different angle to generate a 3D presentation, enhancing diagnosis accuracy. Image analysis. Point 3, that is image analysis. Segmentation techniques such as thresholding and region growing isolated different structure within an image for detailed analysis. Feature extraction. Identify and analyze shape, texture, and pattern to aid in diagnosis. Pattern recognition. Machine learning algorithm detect and classify anomalies like fracture and tumors. Computer aided diagnosis. Automate analysis. CID system use machine learning and deep learning to analyze radiographic image and highlight potential abnormalities, assisting radiologists. Improve accuracy by iterating the detection process. CID system and diagnosis accuracy and efficiency. Data comprehension. Lossless comprehension technique like Huffman coding and run length encoding reduce file size without losing any image detail. Lossy compression. JPEG compression reduce file size with minimal loss of important detail, making storage of transmission more efficient. Lastly, quality control. Calibration and correction methods such as a flat field correction and artifact removal ensure high quality, distortion-free image. Maintaining reliability. This technique are crucial for maintaining the diagnosis reliability for radiography. For second point, that is MRI. What is MRI? It is non-invasive imaging technology that produces three-dimensional detail and anatomical images and often used for disease detection, diagnosis, and treatment monitoring. So, in MRI, they have a few theory behind it, like magnetic field, hydrogen atom, signal detection and image formation, and also tissue contrast and functional imaging. So for the principle, MRI relies on strong magnetic field to align hydrogen proton in body. These protons act like tiny magnets and align with the magnetic field. The resonance, when the magnetic field is disrupted by radio frequency RF pulse, protons are knocked out of alignment. As they return to their original state, they emit signals that are detected by MRI sensor. These signals are used to create detailed image based on the tissue composition, signal detection, and image formation. RF coils. RF coils are essential in MRI as they transmit RF pulse and receive the signal emitted by hydrogen protons. Fourier transform. They receive a signal complex and need processing. Fourier transform convert the signal from the time domain to the frequency domain, producing image that visualize internal structure. Lastly, tissue contrast and functional imaging. T1 and T2 relaxation times. Different tissue have unique relaxation time, T1 and T2, which affect how quickly the proton realign with the magnetic field and lose energy. This difference in relaxation times create a contrast in the MRI image, highlighting various tissue. Functional MRI. fMRI measure brain activity by detecting change in the flow of blood. Active brain area receive more blood, which alter the magnetic properties of the tissue. fMRI captured these changes, providing insight into brain function and activity pattern. Lastly is ultrasounds. They have two ultrasounds, that is diagnostic ultrasound and therapeutic ultrasounds. For diagnostic ultrasound is non-invasive diagnostic technique used to image inside the body. Most diagnostic ultrasound probes are placed on the skin, but to optimize the image, probes may be placed inside the body via the vagina or blood vessel. For therapeutic ultrasounds, this ultrasound did not produce image because the purpose of this is to interact with the tissue in the body such that they are either modified or destroyed. Among the modification possible are moving or pushing tissue, heating tissue, dissolving blood clot, and delivering drugs to specific location in the body. So in ultrasound, they have a few theory behind it. So sound wave and reflection principle. So ultrasound use a high frequency sound wave, typically ranging from 1 to 20 MHz, to create image of internal body structures. Transmission and reflection. A transducer emits the sound wave which travel through the body. When this wave encounter different tissues and organs, they are reflected back to transducer, which detect them. Image formation and signal processing. Echoes and time of flight. The transducer receives the reflected sound wave or echoes. The time is taken for these echoes to return it used to calculate the distance to the reflecting surface, creating 2D and 3D image. Amplitude and frequency. The amplitude of the echoes provide the information about the density and composition of the tissue. Doppler shift or change in the frequency of the echoes measure the movement of tissue or blood flow. Real-time imaging and Doppler ultrasound. For real-time imaging, ultrasound offers a real-time imaging, enabling dynamic assessment of organ, tissue, and blood flow. This is particularly valuable in fields like obstetric, cardiology, and abdominal imaging. Doppler ultrasound. This technique measures and visualizes blood flow within vessel, assessing both the direction and velocity of blood flow, which is crucial for diagnosis vascular condition.